And everyone in Wisconsin age 16 and up is now eligible to get a COVID-19 vaccine.
The state's Department of Health Services maps out all of the vaccinators in the state, and they have links to their websites if you're looking for an appointment, or you can sign up on some waiting lists.
And starting tomorrow, the COVID vaccination site at the Alliant Energy Center will boost the number of doses delivered by 2,100 a week. UW Health Chief Quality Officer Dr. Jeff Pothof joins us for his weekly visit. Welcome back, Doctor.
Hi, Dr. Pothof.
Good to see both of you.
How significant is this FEMA taking over the Alliant Energy Center site?
You know, in general, the faster we can get doses in arms, the better situation we're going to find ourselves in. We're going to get back to normal sooner, and we're hopefully going to beat these variants from causing another wave. So any news that includes having more people getting vaccinated is good by me.
Is the supply catching up to the demand at this point, or is there still an imbalance?
You know, I still think there's more demand than supply, but I do think supply has gotten better. I think the silver lining in that is I know vaccinators are ready to do more vaccines. There's people lining up to get vaccinated. You know, any supply that we get, I think we can use really effectively. Wisconsin's, you know, close to leading the nation in that metric.
Once people are fully vaccinated, what does that mean? What can you do? What can't you do?
So fully vaccinated 2 weeks after your either first dose of Johnson & Johnson or 2 weeks after that Moderna Pfizer second dose, you know, it does afford you some opportunities. You can meet in private residences, unmasked, not distanced, with other people who are fully vaccinated. You can visit a single household of people who aren't vaccinated as long as they're not high risk for COVID. And I think what you'll start to see, and we're starting to see from even the CDC, some loosening on tight restrictions around travel and other things that all of us want to do, but so far haven't been able to do in the pandemic because it just wasn't safe if you weren't vaccinated.
Can you clear up a little bit of confusion about that, though? So you say, okay, I'm double vaccinated. I want to go see my family, so I'm going to travel. But the current CDC guideline recommends against unnecessary travel. So can you see where people are wondering, well, what am I supposed to do?
Yeah, you know, I can see where that's a bit confusing. I think, you know, what it's saying is that if you travel, the risks to you as a vaccinated person is actually pretty low. Where I think the recommendation is to avoid unnecessary travel is this still unanswered question around, can vaccinated people actually transmit the virus to other people? And until we get a little bit more information on that, it's probably hard for them to just, you know, throw the doors open and say, if you're vaccinated, go wherever you want, because we don't know what impact that would have on unvaccinated people.
And this is far from over. I mean, there's outbreaks in Michigan. We had an outbreak at a daycare center in Dane County. 31 people were ill. I mean, you still have to be careful.
Yeah, I mean, the variants are the real deal, and they're trying to make a comeback. So, you know, until we do all get vaccinated, we still need to practice some of these things we've been doing for over a year now. Wear that mask when you're out in public, socially distance, because we really don't want to see another wave, especially with that more contagious variant. It's nothing any of us wants to see.
And now we're hearing about this double mutant variant on the West Coast, which sounds pretty scary, probably scarier than it is. But will the vaccines take care of the variants?
You know, so far the data around the variants and the vaccines is good. You can get mild disease, so people who have contact with variants who are vaccinated may come down with some symptoms, but it looks like, at least from what we understand right now, people who are vaccinated don't get severe disease. They don't die when they have COVID from the variant, which isn't the same story for natural immunity. So another reason for everyone to go out and find that place that you can get vaccinated, get that shot, and, you know, be rest assured that you're well protected against COVID-19.
And once you're fully vaccinated, will you show positive for having COVID in your system?
Right, if you get COVID tested after you're vaccinated, will you test positive?
If you get antibody testing, so looking for those antibodies against COVID, it's possible that your antibody test will be positive, not because you've had natural COVID, but because the vaccine created those antibodies for you. So that kind of COVID test would be positive.
Are you concerned at all that we're heading toward a fourth wave of COVID, or how do you feel about where we are right now?
Yeah, you know, there is some nervousness there because we are seeing case numbers start to creep up. Our percent positive rate is going up. We've got other states, you know, Michigan, New Jersey, where their curve is starting to get a little bit steeper of new cases. So that's what worries me. On the positive side, we are doing a pretty good job with vaccination. You know, we could go faster. We could never go fast enough. And it's really going to be the intersection of those two things, the variants and the cases increasing, or can we get people vaccinated quickly enough such that we don't see another spike?
And I think the good news is people are starting to find appointments available to get the shot.
Yeah, I think appointments are out there. If you call a place and they don't have vaccine, I encourage people to keep looking. We're hearing from lots of different individuals stories of vaccine being available out there, but you just have to look, sometimes with a bit of effort, to find it.
You have to drive a little way sometimes. Too, as I did today. Yeah.
Jeff, good to see you as usual. We'll see you next week.
Talk to you later.
Thank you,
Dr.
Doctor.
Pothof. Thank you for your time.